Dr. Chol Kim here from sunny San Diego, California. I have a high-stakes surgery today because this is one of my very close colleagues who's been with me in the OR intermittently over the last 20 years, so we know each other really well. He had a previous large disc herniation that was treated with an open laminectomy. Unfortunately, it did not go well. Even though the surgeon is an excellent surgeon, there's still some residual disc left and more work needs to be done, and he's not recovering the way he's supposed to. So he asked me to go back in there using the endoscopic technique to finish the job and wish me luck because this has to go well. This is one of my close colleagues and I see him all the time. Yep. Like my mom always said, cheating is not a bad thing because if you don't cheat every once in a while, you ain't trying hard enough. And this is definitely cheating. Look at that. Crazy. The chromato discogram is exactly like expected. The disc is really messed up. There's a big tear going back, and then you can see like an outline of the disc protrusion. I'm feeling very good now. Okay, dilators and reamers one at a time. Look at that. There's that big disc protrusion in the foramen. You can't even see the opening. And there's that big goomba of the hypertrophic facet joint capsule and ligamentum flavum. And to the left of me is the exiting nerve root that contains the dorsal root ganglion. And the dorsal root ganglion is where all the cell bodies live, and it is the most sensitive structure in the entire body. You irritate that nerve root just like that, and they wake up with a postoperative radiculitis. All this is pathologic, and this just goes all the way across. Look at that, there's nothing there. I'm gonna push this down from above as I release it oh so carefully. And the goal is to remove any loose pieces. Okay, let me have the paprika now. There is a lot of pathologic tissue here. And the age-old question, how much is enough? How much disc do I need to take out? Because just like watering a plant, there's such a thing as too much of a good thing. I'll know when I see it though. That's the problem. I need to create a formula. Just keeps on going. Very gently, feeling for loose pieces. There's a lot. See why I hate those loose pieces? It's like a big mess. Can I have the curly Q? Oh man, it's like my punk teenage kids. So there was a juicy piece right there. It's right here. Can I have the regular tutor? I would just kill for an articulating angled pituitary. I would just kill. I'd sell my firstborn grandchild for it. But there's no friggin' way I'm gonna get it. There it is. That feels really, really good. Now I gotta just clear all this stuff away and make room for the exiting nerve root. That's the hardest part of the surgery. Because the exiting nerve root has the DRG, and if you even look at it wrong, it will start getting pissed off. And that's the biggest learning curve complication of the surgery. There's the exiting nerve root. It's on the other side of that fat. And here's where the laser really comes in. If I use the electrical probe, I might shock that nerve because it's been jumping all case. But not when I use the laser. I can get right next to it. Whatever. And I was just saying it doesn't do anything because it's the laser and you just totally screwed me out. If that makes sense. It's mechanical energy. It's like vibrating. Anything? Love you. All right, so I got the huge disc protrusion. I got all the loose pieces inside. I got the tip of the SAP. There's the exiting nerve root. Look how pissed it is. And here's my San Diego trick. I'm going to use this cannula as a retractor and sweep around and make sure the nerve is totally free. Eek. That's the nerve right there. I still get chills when I see it. And it bleeds like crazy here because nerves need to generate electricity, and that requires tons of energy. And all energy is delivered by way of blood vessels. Lots of inflammation. Because I'd be the type of plumber that after I was done, I'd clean up my mess like you wouldn't believe and leave it like even cleaner. I don't know how I did this surgery without this articulating instrument. And yes, that's why I save everything for last, because where the nerves are is where the blood vessels are. And I can tell there's plenty of room here. Plenty. I don't want to devascularize things. I just need to release it and try not to cause bleeding, because bleeding is not good either. Bleeding causes inflammation. Okay, now I'm on the contralateral side, and look at the blue came all the way across, which makes sense. Goes all the way up to the DRG, which is pinched on the other side by this hypertrophic facet and capsule, which is confluent with the ligamentum flavum, and it's like gristle. And anything just even irritating the DRG, it doesn't even have to be mechanical. It just has to interrupt the blood flow. Because that's where all the cell bodies are, and the cell bodies are what uses the most ATP. Hence, they're the ones that need the most blood flow. Hence, this is why this is so bloody right here. Hence, that's why endoscopic is so much better, because if you do this mini open, it's a bit of a bloodbath. Even when the aiming laser stops working, it still works, but not as well. San Diego pimple popping maneuver that I'm going to do that last though, because it bleeds out there. Yeah, if he starts getting good results, I'm going to definitely watch what he does and learn. Because I've been in like a little silo. We can have the salt and pepper. This is the paprika. I want the salt and pepper. Look at it. Let me use this real quick. Okay, that's this protrusion on the right side, the opposite side. Feeling good. Both sides are terrible. I'm so glad we went bilateral. This part is going well. Can I have the regular too, Terry? Wow, there's a lot of disc over here. This is really far lateral. Miran, everything quiet with the right side? It is socked in, but not no more. The latest and greatest, the butterfly handle for endoscopic surgery, which makes much more sense than using a trigger handle, just because of the geometry and the ergonomics. I'm so glad I stuck with it. Look at how big that piece was. Because I had this feeling that something was in there and it wasn't right. That's the little voice inside my head saying, I smell a rat. Now the two Terry back. Upside down. I'm starting to get bored. I'm irritable with all this extra stuff. Now for the San Diego sweeping maneuver. There it is. There's the nerve right there. Anything, Miran?
It is quiet.
Okay, that is the tip of the SAP. Yep, right there, right there. Oh, I feel like such a cheater. And I need to get right there from the MRI. And that's what's blocking me. That's what's got to go. Oh my God, navigation's awesome. You see how I say, like, if you don't pay attention. There's the tip. It's not bone, it's all soft tissue, which makes sense based on the MRI findings, but it's always nice to confirm it in two different ways. I'm almost done, Ian. That's why I saved that for the end. Lots of inflammation on this side. But not no more. Pencil. Okay, all done now. Bring up the closing tray and such. Surgery is all done. It went absolutely beautifully. I got a lot of disc out. Those are just the pieces that we saved. There's so much more than that. And then 3 very, very expensive Band-Aids. I know they look just like the ones you get at Vons, but they're so much better, I swear, because they're a hospital Band-Aid. And I'm feeling so good. We're all expecting a great result and praying for a speedy recovery, so best wishes.